All right, let's get right into it. Today, we're diving into a medical mystery, a condition that can cause so much pain it can literally stop you in your tracks. But here's the crazy part. It often comes from a source smaller than the head of a pin. We're talking about glomus tumors. I want you to just imagine this for a second. A tiny, tiny little dot on your fingertip that causes a level of pain so extreme, so unbearable, that it completely messes with your life. It sounds almost unbelievable, right? But for some people, this is their everyday reality. And we're not talking about a dull ache or a simple throb here. The people who experience this describe it as a stabbing pain, or like getting an electric shock, all focused on one incredibly sensitive spot. It's a really specific and frankly awful sensation. So, let's start playing detective. How do we identify this tiny source of massive pain? What are the key things to look for? And, most importantly, what are the big red flags that tell you it's definitely time to go see a doctor? Okay, here are the major clues you need to know about. First, it's a persistent, really bad pain that stays in one single spot. Now, this next one is a huge giveaway. The pain gets way worse with cold. We're talking reaching into the freezer and getting a jolt of pain. And if you start to see your fingernail changing shape or getting deformed, or if this pain is so bad it's messing with your job or your sleep, those are serious red flags. So you've noticed the signs and you go to the doctor. How in the world do they actually find this hidden culprit? Well, this is where the real medical investigation begins. This is actually pretty fascinating, the difference between what you feel and what a doctor can actually see. You're feeling that horrible electric pain and tenderness. The doctor, on the other hand, might see a tiny bluish or reddish spot under your nail. And they have a special test, it's called Love's test, where they press on that exact spot with a pinhead to see if it triggers that intense pain. You can think of the whole process like a funnel. It starts broad with a physical exam, and that often points the doctor in the right direction. But to really confirm it, the gold standard is an MRI. That scan gives them a crystal clear picture, showing the exact size and location of the tumor, no matter how small it is. So, the culprit has been found. The mystery spot has been identified. But what exactly is this thing? Let's finally put a name to this strange source of pain. Okay, so a glomus tumor is basically a tiny growth. It comes from something called a glomus body, which is a part of your skin that helps control your body temperature. But here is the most important part, the thing you absolutely need to hear. It's benign. That means it is not cancer. As painful as it is not life-threatening. Now, if you're sitting there thinking, I've never even heard of this, well, there's a very good reason why. Just look at this chart. Glomus tumors are incredibly rare. They make up less than 2% of all tumors found in the hand. And that rarity is a big part of why it can take so long for people to get a correct diagnosis. So who usually gets these things? Well, it's typically adults between the ages of 20 and 50, and it seems to affect women just a little more often than men. But really, the main group of people are those who've been suffering for a long, long time with that very specific, unexplained fingertip pain that we've been talking about. Okay, so we know what it is, we know how to find it, and we know who it affects. Now for the most important question, what do we do about it? Let's talk about the path to getting some real relief. When it comes to treatment, the choice is pretty clear-cut. On one side, you've got the non-surgical stuff, like avoiding cold or taking pain medicine. Sure, that might help a little with the symptoms, but it doesn't fix the actual problem. On the other side, you have surgery to remove it, and that is considered the definitive cure. It's the standard, recommended way to go. And the surgery itself is a really precise operation. The surgeon uses magnification to see the tiny tumor and carefully removes the whole thing. They take a lot of care to protect the nail and surrounding tissue, which gives you the best chance for a great recovery. And here it is. This is the number that really says it all. Over 95%. That's the percentage of people who get complete and permanent relief from their pain after the surgery. That is just an incredibly high success rate. It's a true game changer. So, this surgery is a massive success. The tumor is gone. What happens next? What does life look like after the procedure? And what's the road to recovery really like? The recovery is actually pretty straightforward. For the first couple of days, it's all about keeping your hand elevated to help with swelling. You'll have a checkup in a week or two. You'll want to take it easy and avoid any heavy lifting for a few weeks. And then, over the next several months, your nail just regrows, usually completely back to normal. So the bottom line here is that the prognosis is just excellent. For so many people, the relief from that terrible pain is almost immediate. Think about that. After possibly years of suffering, the pain can just be gone within days of the surgery. And that really brings us full circle. If you or someone you know has been dealing with that very specific, localized, cold, sensitive pain with no answers, just know there is a potential solution out there. So you have to ask, could a tiny, hidden tumor really be the answer to years of unexplained pain? For a lot of people, the answer is a resounding yes.